Hello, everyone. I'm Dr. Susan Slovin. I am a genitourinary medical oncologist at the Sidney Kimmel Center for Prostate and Urologic Cancers at Memorial Sloan Kettering Cancer Center in New York. I'm a medical oncologist and not the person who does the prostate biopsies. These are usually done by a urologist. So if we were to go back a number of years, we used to do what we called a sextant, S-E-X-T-A-N-T biopsy. So if you look at the prostate, forgive me, it may not be the most accurate and it may look like a heart, but this is exactly what it looks like. The anus or rectum is down here, the bladder is up here, and this is the prostate. And we used to do, or we, meaning the urologists, used to do a biopsy at the top, which we call the base, in the middle, known as the mid, and at the bottom, called the apex. And a grand total of 6 were done. And over time, these little biopsies, and again, the biopsy is no greater than about 3 millimeters long by 1 millimeter across. It's very mucousy, and if you didn't know better, you would think it's nasal discharge. But the way it's done today, and has been done for years, initially was to take little 6 samples, and now it's about 12 samples. So we actually can map out exactly where the disease is located. The biopsy is done using a needle. It's almost like a pneumatic gun through the rectal wall. So anatomically speaking, if this is your rectum here, that's the channel, the prostate is on the other side. And it's very easy to introduce a needle. It's done under ultrasound guidance. So it's what we call the transrectal ultrasound. There's a probe that's in the area there, and you're able to see exactly where the borders of the prostate remain, and that there are little punches, 1, 2, 3, 4, 5, up to 12, and even 24 can be done, that are very easy to do. Usually antibiotics are given before the procedure, 24 hours before the procedure. A laxative is also given so that the area is nice and clean. Systemic or generalized anesthesia is not needed. This is usually done with a little lidocaine jelly that's introduced. And the whole procedure is roughly 10 to 15 minutes. It does not require hospitalization. It is completely outpatient treatment. Those little samples, as I've mentioned, are immediately sent to pathology, and each one of those samples is evaluated for a Gleason score, with the idea that the highest value or the highest score is really what is going to be the reason for making a particular treatment recommendation. Following the biopsy, men may find that their ejaculate may be dark brown, again, some blood in the ejaculate, there may be some rectal bleeding, and also while urinating, there may also be a little bit of blood. That can last for a couple of days. Even in the ejaculate, it could be a couple of days or maybe 2 or 3 weeks, but for the most part, I would say patients will talk about it for about 7 to 10 days, and it's not going to be every single day. It does not affect your ability to have intercourse, nor does it affect any other function with regard to defecation or urination. Completely safe. Again, very rapid way of doing the biopsy, and most urologists are quite competent in doing it without any major side effects. The only other side effect I can tell you that can occur is you could get an infection, which is true of any invasive procedure. But again, it's not invasive in the same way of doing an open operation. It's just literally punching through the rectal wall to get to the prostate.